Welcome to this presentation on Frank S. Betts and the medical marketplace of 1895. In this session, we'll explore how Betts' work as a medical instrument manufacturer exemplified a key turning point where medicine and industry formally intersected. In 1895, Betts founded his medical instrument company in Chicago, a hub of innovation during the Gilded Age. His approach was industrial, entrepreneurial, highly effective, using a mail order catalog system and bulk manufacturing to make diagnostic and therapeutic tools more widely accessible. But Betts wasn't just selling equipment, he was reshaping how medical care was delivered. Betts' company represented more than just efficiency, it embodied a new mindset that medical technology could and should be distributed, standardized, and systematized. His success was fueled by both progressive era ideals and a Protestant work ethic that saw technology and commerce as tools for moral and professional uplift. This presentation will show how Bett's business model planted the seeds for clinical engineering by building the very infrastructure of tools, systems, and ethical frameworks that today's engineers work to maintain and improve. The year 1895 was a pivotal moment in American innovation, infrastructure, and reform. Three major developments helped frame the world in which Frank S. Betts launched his medical instrument company. First, the Duryea brothers built the first American gasoline-powered automobile, ushering in a new era of mechanizing and mobility. This was more than just a transportation milestone. It signaled a cultural shift where machines became central to everyday life, including medicine. Second, the progressive era was beginning. Reformers across the country were calling for safer working conditions, consumer protections, and better public health standards. It was a time of optimism, but also of growing scrutiny, when regulation and innovation were no longer at odds, but mutually reinforcing. Lastly, industrial capitalism was expanding rapidly into new sectors, including science, education, and healthcare. Private companies began investing in areas previously left to charitable institutions or local governments. Medical devices and diagnostic tools were no longer handcrafted in small batches. They were being mass produced, marketed, and shipped nationwide. This historical backdrop helps us understand why Betts' medical supply business took off. He was operating at the intersection of technology, commerce, and reform, offering standardized, affordable tools at a time when the healthcare system was ready to modernize. In 1895, Frank S. Betts founded his medical instrument company in Chicago, a city at the center of American manufacturing, innovation, and transportation at the time. What made Betts' approach so successful was that he brought industrial scale thinking to healthcare equipment. Instead of relying on word of mouth or small regional sales reps, Betts used mail order catalogs to reach physicians across the country. This was a major breakthrough in access. Rural doctors, small town clinics, and emerging hospitals could now order high quality instruments with the same ease as urban professionals. He also scaled up production, making instruments cheaper and more consistent. By mass producing tools like stethoscopes, thermometers, and surgical kits, Betts made medical technology more affordable and, equally important, more standardized. This wasn't just a business model, it was a paradigm shift. By industrializing medical supply, Betts helped transform healthcare from a craft based system into a technology supported profession, paving the way for what would eventually become the supply chains and clinical engineering infrastructures we depend on today. Frank S. Betts' success as a medical entrepreneur wasn't just about clever distribution or industrial efficiency. It was also grounded in a strong moral worldview, one shaped by what we often refer to as the Protestant work ethic. During the late 19th century, many business leaders and reformers believed that hard work and service were not only economic virtues but spiritual callings. Betts embraced this philosophy. He saw the production of medical instruments not just as a business, but as a public service, something that could uplift society by improving healthcare access. For Betts, medical schools were both products and public goods. His catalogs emphasized utility, affordability, and trust. These were not luxury items, they were instruments of care, tools of healing. Making them accessible wasn't just about profit, it was about fulfilling a moral obligation. In this way, Betts tied entrepreneurship to ethical responsibility. He modeled what we might call technological stewardship. The idea that creating and managing technology comes with a duty to serve human dignity, safety, and well being. That idea is very much alive in today's clinical engineering, where technology is not just engineered, but ethically maintained to protect lives. Frank S. Betts didn't know it at the time, but his approach to medical manufacturing planted the seeds for what we now recognize as clinical engineering. First, he emphasized device quality, availability, and standardization, three pillars of what modern clinical engineers now monitor every day. Tools had to be reliable, safe, and reproducible, no matter where they were shipped or who was using them. Second, Betts helped establish the idea of a service centered supply chain in healthcare. His mail order catalog wasn't just a sales tool, it was an early logistics platform. It ensured that physicians, no matter how remote, had timely access to the instruments they needed. That model mirrors today's emphasis on just in time device availability and lifecycle management. And finally, Betts' legacy aligns with today's clinical technology management. His belief that tools should be accessible, trustworthy, and morally aligned with healing laid the groundwork for a field where technology is not just maintained, but ethically supported. Clinical engineers today manage inventories, safety checks, procurement, and performance, all in service to do patients and providers good. In short, Betts turned distribution into infrastructure and infrastructure into care. That's exactly the space clinical engineers still occupies today. As we conclude, it's clear that Frank S. Betts did more than sell instruments. He laid the groundwork for a system that transformed how medicine was delivered. Betts turned medical schools into infrastructure. His catalog model, mass production, and commitment to affordability helped establish the modern medical supply chain. He didn't just distribute equipment, he made consistent, reliable access to medical technology part of the fabric of healthcare. This evolution happened during a period when medical capitalism was taking shape. Business and care became intertwined, and while this raised complex questions, Bett's model showed that commercialization could still serve ethical and practical goals. His tools made medical care more accessible and standardized, paving the way for more safer, organized treatments. Today, clinical engineers continue that mission, not by selling instruments, but by managing the systems that keep them working. Their job is to ensure that every device in the hospital or clinic is safe, functional, ethical, and maintained. In this way, Bet's legacy lives on, not just in tools, but in the values that shape how healthcare technology is delivered, supported, and most of all, trusted.